this it concerns a study using BCMA-directed CAR T-cell product cilta-cel for relapsed refractory multiple myeloma. Now, in the CARTITUDE-1 trial, the overall response rate was nearly 100% and a CR rate of 80%, and the progression-free survival is now approaching 2 years with a very acceptable CRS and with also using a new mitigation strategy, also an acceptable neurotoxicity. So the idea was now to move these very effective BCMA-directed CAR T-cell product to earlier lines of therapy. And 20 patients were actually included. And the good thing that was really noticed is that there was no additional toxicity. We all were afraid if we would take the T cells earlier, at an earlier stage, more effective, more active T cells, we might see more toxicity. And that was actually not the case. And there was no late onset neurotoxicity that was seen in a few patients in the CARTITUDE-1 trial. So this was very reassuring. And at the same time, also the response rate was quite similar. Maybe we would have expected a bit more overall response, more complete remissions, but due to the small number of patients and also a short follow-up, actually it couldn't be shown yet that early application of cilta-cel was much more effective than in the late stage disease. There are two things. At the moment, several studies are looking at earlier therapy, so even going into first-line therapy in high-risk patients, first relapse. And there's actually a study that is planned for maybe starting next or 2023, when actually autologous stem cell transplantation is challenged by CAR T-cell therapy. And then we will really see to better define the role of CAR T-cell therapy in the whole spectrum of anti-myeloma treatments that are available now.